The truth about hormone therapy, why bioidentical hormones are safer and more effective. Hi, I'm Dr. Myra Reed with over 33 years of medical experience as a functional internist. So today I'm going to talk to you about restoring hormones and hormone balance. Did you know that 25 years ago there was a study that was done that just scared everyone about using hormones? Well, we know that today that 55 million women are in menopause. That's not even including the women who are in perimenopause or the men who are going through andropause. So women live 1/3 of their life beyond menopause. This is horrible numbers. We know that when you lose hormones or go through menopause, you start having things like depression, anxiety, brain fog, memory issues, dementia, hot flashes, sleep and insomnia issues, vaginal dryness, sexual libido dysfunction, and overall sense of well-being is just diminished. So we know that once people get on hormone replacement, that they just feel better because studies have shown that hormone loss causes inflammation in the body, cognitive decline, which is memory issues, bone loss, such as osteoporosis and osteopenia, and muscle loss. People start having issues like their body just starts changing. They start gaining weight. They start getting humped over, start stooping over. They don't walk as well. Their balance gets off. It's just your body just starts diminishing. You start having things like insulin resistance or prediabetes or even diabetes. You're more at risk for heart disease, vascular inflammation. And did you know that the leading cause of women's death is heart disease? People start having increased blood pressure. And we know that having increased blood pressure leads to all kind of other problems as well. Well, one thing we know that once you get on hormone replacement, you get an improved quality of life. Your mood is better, your energy is better, your sleep is better. You have improved libido and sexual function. But also added benefits are going to be things such as weight loss. You're going to have improved muscle and bone. Your skin's better, more elastic. People start saying, wow, you just look so much better. What are you doing? You just look healthier and younger. What are you doing to roll back time? So you even have to start improving with your memory is improving. Your brain fog starts going away. You just overall have better vitality and anti-aging. Scientific evidence shows the benefits of hormone replacement. There are so many studies out that are showing the reduction in all-cause mortality. Well, what does that mean? All-cause mortality reduction means that you're going to have less death at an earlier age. In other words, you're going to live longer. You're not going to die as young. You're going to have reduction in Alzheimer's by 30 to 50%. That's huge. Prevention of heart disease and reduced risk of stroke or an MI. There's also reduced in cardiovascular morbidity, which means that people are going to have less heart attacks or heart disease or cardiovascular events like congestive heart failure or loss of ejection fraction of their heart. There's prevention of colon cancer, which is huge. Who would think that replacing hormones would decrease your risk of colon cancer? Also, prevention of osteoporosis, which I mentioned is bone loss, because when you have osteoporosis, which is bone loss, you have a higher risk of falling and fracturing a bone. And we know that when you get a hip fracture, that people's lives just decrease faster and faster, and they don't live as long. There's also prevention of age-related macular degeneration by 90%. That's huge. If I could do anything to keep my vision longer, that I would. And one of those things is hormone replacement. Also, reduction in deaths, and this isn't surprising, in breast cancer. It's the opposite of what we thought. Everybody's always afraid. I'm going to get on hormones. Well, I can't because I'm afraid of breast cancer. That's the myth that was proven 25 years ago using synthetic hormones, not with today's bioidentical hormone. It's actually the opposite. That's very huge and very surprising and very eye-opening for a lot of people. Also, you have no increased risk of a stroke or other cancers. if you think that getting on hormones is going to cause stroke, it's actually the opposite. So bioidentical hormones came about showing that they are the same as what our body structure is. Now, what does that mean? They are making these bioidentical hormones exactly the molecular structure that our endogenous or inside of our body produces, just like our own molecular hormones. These things are the hormones that we're talking about for our bioidentical hormones are things such as estradiol, estriol, progesterone, testosterone, DHEA, thyroid such as T4 and T3, which are the hormones made by the thyroid that go and attach all the receptors in our body that makes everything work, such as our heart, our bones, our muscles, everything in our body, our energy production. And also melatonin, which is the sleep hormone, which helps us sleep better. So the hormone replacement options. The BHRT, which stands for Bioidentical Hormone Replacement Therapy, is the natural one I just talked about. It's the human identical one. Then you have the animal-derived one, which is the one that's made from the equine or horse urine. That's the old-time Premarin that people used to take. And maybe some people still do. I don't prescribe it, but... And then you have the non-molecular identical one, which is the synthetic ones, which got everybody in trouble. That's with the one 25 years ago that the study that scared everybody. That was Provera, which is the medroxyprogesterone, the synthetic progesterone. But you also have the other synthetic hormones like norethindrone, which is in the birth control pills. And you even have the other esterified estrogens that people take orally, which I don't recommend. Then you have the plant-derived from soy and black cohosh. Those are more for the hot flash symptoms. And then xenohormones, the non-replace, you don't want to replace these. These are the endocrine disruptors. These are the toxins that occur either naturally or synthetically in our environment that are made from a lot of chemicals and plastics and even things that are in our personal care items that are endocrine disruptors or hormone disruptors. So, bioidentical hormone safety. Again, over the last 25 years, they have published these studies from Europe and from the US. Just numerous thousands of studies have been done showing the benefits and the effectiveness of these bioidentical hormones versus the non-bioidentical hormones. The published studies have showing the safety and the lower risk of disease. This benefits not only women, but also men. So this is replacing what is lost when we age and naturally progression of our hormone or our body's aging. And now we can replace these more naturally. So compounded hormones, these are made identical to our natural structure. They're made in all kind of different forms. The compounding pharmacies can make them into creams, into gels, even capsules or troches, which you can put under in your mouth, or even injectables and pellets, which are really a game changer for a lot of people. There's a lot of different ways, and everybody's different, so not everybody's going to use the same hormones or the same kinds or the same way they're going to get it. That's why you have to consult with somebody who knows about hormones, because no two people are the same, and you're not just going to go to the pharmacy and everybody's going to get the same thing. There's all kind of different ways of prescribing them. And you're not going to just go to every pharmacy. Sometimes you can go to a regular pharmacy and just get certain kinds of hormones, but there's also compounding pharmacies that can make the bioidentical hormones in different forms and different strengths and different slow releases or different techniques. These compounding pharmacies are state regulated, and they also go through the Pharmaceutical Compounding Accreditation Board. They're also tested for purity, and the FDA will go and inspect these facilities, but they don't have to be FDA approved since they're not mass produced. And because of this non-FDA approval, a lot of times medical insurance may not pay for these compounded hormones because they're considered experimental drugs to the insurance companies, and they may not be covered by your insurance, but you can still get them at a reduced price and pay cash for them. The bioidentical hormone replacement therapy, the BHRT, has really come a long way over the last 25 years. I really encourage you to research about these bioidentical hormones and really think about the replacement of using these because there's so many advantages. I know I love using bioidentical hormones, not only for myself, but for my patients, and they get dramatic benefits. Of course, you're always going to want to be monitored and make sure that you're getting a good history and doing your mammograms and getting your annual exams, but you really need to be knowledgeable about the benefits and the safety of these hormones, and also use good sense about who you're going to and who's prescribing them. But if you want to know more, I encourage you to check out my website and learn more about. I'm going to be giving a lot more information on this. You can call my office or check out my website, Dr. Myra Reed. I would be happy to talk to you more about it, because we all want to have a better quality of life and to live longer, feel better, and have better longevity and vitality.